So I will open us in a word of prayer. Just bow our heads. We tchalakat kum nagwat ludal zum lachagi. O exitmin klomin waginam amasat lam. We thank you for this beautiful day that you've given us to gather. We ask that you guide us in our discussions and provide us with the wisdom and knowledge to protect our nation. We pray for those that have lost loved ones and are grieving. We pray for those that are battling illnesses. We ask that you be with them, Lord. Be with our nation on this day and in the days ahead. We ask this in your name. Amen. Okay, so I'll give an overview of our agenda. We're going to I'll just share my screen so you can see the agenda. So we'll do a round of introductions, and then we'll get into a brief of update on government supports from Mr. Ryan Hales, and then Anthony Moore will get into the Nishka Nation's strategic restart plan, NVHA COVID-19 response from Lisa Gosnell and Jeremy, and then we'll go into question and answer following their presentations. So as I mentioned, we have our guest panelists today with us. Mr. Anthony Moore is Nishka government's Emergency Response Services Manager. And we have Lisa Gosnell and Jeremy from Nishka Valley Health and Ryan Hales from MNP. So with that, we'll have Ryan provide us an update on government supports.
Thanks, Bobby, and thanks everybody for tuning in and for all the other panelists for participating. I will be very, very quick because I imagine you're all pretty eager to get onto the restart reopening plan and hear some interesting news there. We've just thought it'd be a good opportunity to provide an update on some of the programs we've talked about in previous webinars, and maybe highlight on a couple new ones that have come out in the last couple weeks. So on the individual basis, we would have talked about at the last webinar that the SIR program was being extended. So we now have official notification that it's been extended for an additional 8-week period. So that will be two more of the 4-week SIRB eligibility periods, which I think is a welcome change to the program, given the time it's taking to get things restarted and to get businesses back up and running and employment going full swing. So that's one that's been updated at the federal government level. Another really interesting program that's just come out in recent days is the Canada Student Service Grant. So I know there'll be a briefing and some information coming out shortly on the website there, but a brief or kind of quick update on that. What that is a grant from between $1,000 to $5,000 for students who volunteer during the COVID-19 pandemic. So those are for students who come home from university or finished high school and choose to go out and support their communities in place of being employed. So these benefits are stackable, which means they won't affect eligibility for other things like the Canada Student Support Benefit or any of the other programs that are out there. So I think that's a really good program, and it really promotes kind of volunteering and getting out and doing what's best for your community. So I know we'll have kind of more information on a later webinar on that program. Other updates, BC extended the tenant rent supplement program, so that's going on for the months of July and August. So that may be applicable to some citizens. There's a number of criteria for that, but the high-level version is you have to fall below a certain income threshold that is relatively high, actually, and then you must be receiving CERB or employment benefits or one of those other programs and be able to show that your household income has dropped by 25% or more as a result of COVID. And then the other requirement there is that as an individual, you must be paying 30% or more of current household income towards rent, which isn't hard to do in this day. And then your housing, your rent unit must not be another government subsidized program, and it must be covered by the Residential Tenancy Act or one of the other rental acts. So that's an exciting update on the individual piece, and another piece of welcome relief, I think. Just in addition to that, and something I know we'll be talking about in future webinars, there's been some updates to the business programs that are out there. So the Canada Emergency Wage Supplement program that provides for a supplement of up to 75% of wages paid to employees, or an employee's normal wage, has been extended to the end of August. So I think that's a great program, certainly one that's out there to support businesses and help keep things running during these tough times. Another program that has seen some updates and changes to be applicable to a wider range of businesses is the Canada Emergency Business Account. So that's a loan program whereby you can borrow up to $40,000 if you qualify, $10,000 of which can be forgiven as long as you're on the appropriate repayment schedule by December 2022. What the changes are, that has been open to small businesses that kind of have qualifying expenditures, but the updates have been a bit of a broadening of the scope to include proprietorships that maybe don't have wages. So if you are a sole proprietor earning income and you do have ongoing business expenses, you would now be captured in the eligibility criteria for that, assuming you meet all the other criteria. So I think that's a really important one to consider, because that certainly kind of fits the owner-operator style businesses, the small businesses that are maybe functioning out of homes and the like, that maybe don't have employees, but still are the main lifeline for their proprietors. So that's a exciting one, and I know we'll be talking about that at an upcoming business supports webinar. And then the only other thing I wanted to quickly touch on was just a summary of the tax filing deadlines. We'll just stick to the individual basis there. I know we've talked about it a lot, but tax payments, taxes owing, are still due by September 1st, as they have been since the COVID extension came out. And then, of course, if you haven't already filed your tax return, it was technically due on June 1st, but the government had said that there would be no penalties or interest for late filings, as long as you file and pay in full by September 1st. So what they effectively did was update the deadline to September 1st. So I think that's just another important one. If you haven't filed your tax return yet, definitely go down that route, because it can impact a number of the benefits that are out there. And I think that's everything I had for today. Thanks.
Okay, great. Thank you, Ryan. For those that don't know Ryan, he's joined us in the last two webinars as part of our series. And MNP has been working with Nisga'a government on preparing all of this information that we've posted to our website with respect to federal and provincial programs, funding programs in relation to COVID-19. So as you'll see here, we've developed a number of questions in relation to CERB. These were largely derived from the questions that came in as part of our first webinar. So this is information citizens are wanting to know, and it's very helpful information to allow you to access if you're eligible for these various programs out there. So check back on our website for information as we continue to update it. If you just go to the social services tab and COVID-19 down here, that's where you'll find all of this information. So I'll stop sharing my screen now, and welcome if you're just joining us. We just received an update on federal provincial programs from Mr. Ryan Hales, and now we are going to move along on our agenda, and we'll welcome Nishka government's Emergency Response Services Manager, Mr. Anthony Moore, who has been working with the Nishka Emergency Preparedness Committee, since COVID hit in mid-March, they've been actively working collaboratively on the nation's response, along with NVHA school district and the RCMP. So without further ado, Anthony will be providing us an overview of the Nisga'a Nation Strategic Restart Plan. Anthony?
Thank you, Bobby, and good afternoon to all the attendees. Thank you for taking the time to join. So I'd like to start with just an overview of what the plan is and how it came to be. So the plan takes the phased approach to mitigate the impacts of COVID-19. Each phase provides guidance for the individuals and businesses within the Nass Valley, and everyone's free to go at their own pace between each of these phases as per the province's restart plans. So businesses and organizations may not follow the same timelines for reopening or expanding their interactions. All Nishka citizens have a role to play in reducing the possibility of transmission. We must continue to take it slow and be cautious to progress through each of these phases. So phase one was basically our response from March to approximately mid-June. So that's where the Emergency Preparedness Committee was enacted to take control of the overall response. Offices and businesses reduced their hours or locked out their access to the public, and so on. All of the things that we've seen over the last 15 weeks. So phase two, in line with what the province has implemented, on June 29th, so yesterday, public facilities that have prepared their plans and developed the barriers and necessary physical distancing within their building have been able to reopen, what we call a soft opening. So basically, they're able to start opening up their buildings, such as the rec centers, the youth centers, in some cases the churches, and their village government building to open up more access to the general public. During phase two, we're also continuing to monitor the COVID-19 pandemic. Essential travel is still maintained, as well as the physical distancing. Day use for picnic sites and campsites will be opened up as of yesterday. So I'll highlight more areas as we get more in depth into the plan itself. The day use of designated provincial park sites, so the Lavabed Memorial Park, there's certain areas that are being able to open, and certain parts of the park will remain closed. Certain recreation and sports will be able to begin with some social distancing practices still being maintained. Parks, benches, and outdoor spaces will also be reopened. So the playgrounds, the tourist sites, the auto tour sites, certain restaurants that meet the criteria, cafes, coffee houses, will be able to reopen. What we're watching to ease the restrictions and possibly move into phase three would be the incubation period. So monitoring the incubation period as it relates to the policy changes that we have for opening our businesses and our government buildings. Tracking the number of confirmed recovered cases within Northern British Columbia, as well as the number of confirmed cases. For monitoring outbreaks, we'll be connecting with EMBC and Health EMBC to oversee how effective the general public is with regards to location, size, and severity of a potential outbreak, as well as how other jurisdictions are being able to respond. So the Terrace area, Prince George, the North in general, or Vancouver. So from the onset, we established clear guidance and transparency as much as we could, and used an evidence-based approach from Nisga'a government that we've adopted to fight against COVID-19. And a lot of the guidance came from Nishka Valley Health Authority, First Nations Health Authority, and Northern Health Authority. Working together, we made a lot of progress. The protective measures and restrictions that we've implemented have saved a lot of lives. Our focus has always been elders and our most vulnerable population. And as we transition into what the province has used as the new normal, the progress and the fight against COVID-19 as a direct result, sacrifices and decisions that we've made continue to protect our elders and our vulnerable. We're trying to also ensure that our healthcare system is able to respond to this dangerous virus. And the new normal, what that means to you, is staying at home and keeping safe whenever you feel you have a cold or flu-like symptoms. We're all well aware of what those are: the coughing, the sneezing, the runny nose, sore throat, fatigue. Try limit your handshaking and hugs outside of your immediate family. Practicing good hygiene, so as we've all been doing with the washing hands, avoid touching our face too much. Covering our coughs and sneezes, keeping the social distancing as much as possible, and considering wearing masks or some kind of face covering. So the protocols for the public facilities as we move to through these phases, the elimination of is the first level of protection. So the policies and procedures to keep people safe from physical distance from one another, limiting the number of people in the facility at any time, and implementing protocols to keep workers 2 meters apart from other workers, customers, and members of the public. Establishing engineering controls, such as installing barriers like plexiglass, designating certain walking areas for narrow hallways, administrative controls such as establishing rules and guidelines such as this plan itself. And each village has a more comprehensive version of the plan that we'll be presenting. So the fourth level is the PPE. So the masks, the gloves, the non-medical masks, all those types of measures that you would be able to obtain and use on a regular basis when utilizing these facilities. As we move on, we have specific information for staff, response considerations, as well as response considerations for the general public. If you scroll down a little further, Bobby. So do not work when you are showing any symptoms. We just want to make sure we reiterate this as much as possible. And encouraging people to contact Nishka Valley Health Authority for testing for COVID-19. We've done many tests over the last month or so, and have had great success with those tests. So considerations for the general public, if you're showing any symptoms as well, return home, and encourage to get tested as well. Keep hand sanitizer available when you're using upon entrance of any of the buildings, and also sorry, I lost my train of thought there. Just hand washing as much as possible. So all those things that we've been maintaining is what we're asking to do. So the overall plan itself if you go back to the table of contents, Bobby, on page 3, this will give you an overview of how we structured the plan itself. So what I read to you was the Nishka Nation restart plan, how we move through the phases, what the new normal is, and general considerations. So with each village, starting with the village of Galactamics, we have specific plans for Galactamics village government, the auditorium, the rec center, the Head Start and Nursery program, the New Ash gas bar and post office, the interpretive center, Shanika's restaurant, and also the GNU store, just as an example of what type of businesses and organizations are included. With Gitwin-Silk, we have the Gitwin-Silk Village Government Building, as well as the Deldup Memorial Rec Center. So if you go down to Nisga'a Village of Giladamic on page 10, you just click on that. Each of those highlighted areas in gray are hyperlinked, so you can click on those links to get to each section individually. So if you look there, you see Galactamic's Village Government Building, and it has information such as screening of staff. So staff feeling unwell with the cold or flu, any COVID symptoms, will be denied access to the building. Safety measures in place: all staff must hand wash frequently, use hand sanitizer dispensaries, cough or sneeze in the crease of your elbow, and social distance from other staff for at least 6 feet. Other measures such as entrances and exits, designated one-way entrance, one-way exit, placing signs and posters at the entrance to remind staff that the public, if they feel sick, or and also provides specific information. And we go down to, say, the front receptionist. They'll have plexiglass there for the main receptionists as a control measure. For public washrooms, as an example, they'll be well stocked with soap and paper towels to encourage frequent hand washing. It will be cleaned frequently and for public use only. And no staff will be permitted to use the public washrooms. There'll be a separate one for the staff. Information for the general public as we go through both pages there at the bottom. So you must phone in and make an appointment ahead of time. Designated specific areas for the general public to meet with staff one-on-one with a reminder of social distancing. The public must sign in with the building premises with direction to the individual must be made ahead of time when they book the appointment. Public are not permitted to go into the staff areas. They'll have specific areas within the building that you'll be able to go to, and payments from the public must be in a designated area and keep social distancing. So that's a general overview of what you would be expecting for a village government building or similar. As we scroll down to the Gitmedik Auditorium, it's got a completely different set of guidelines based on the type of building it is and what it would be used for. So the space and density, the number of participants allowed to enter the building at any time must adhere to the spacing requirements for social distancing of 6 feet. So given the size of the building, the village government would then measure out a certain area for seating or tables or what have you, so that you can maintain that aspect of social distancing. Also communications, showing the general public what your employees are doing to support the efforts to slow the transmission, whether it's online or VHF or signs and posters. So multiple levels of communication so that everybody has the same information. Individuals who work in high-risk areas at high risk for contracting COVID-19 do not take part in are not to take part in recreational sports or camp activities. for public events, such as meetings or events that will be scheduled with the village government, plans for participants, seating arrangements, and who will monitor participants entering the premises will be submitted to the CAO of the Giladamic village government. And we also have in there court proceedings, because there's a lot of court that happens in this particular building. And this is just a general overview. The actual event itself has its own set of guidelines, sort of an internal document that is followed by all the attendees for that specific event. As we scroll down to the rec center, a portion of the topics that are included here are similar to what is included in the Gitmedig auditorium section, with the addition of sports and weight rooms. There's additional information there on how to protect yourself while you're in those areas as they begin to plan to reopen. So a bulk of these sections are very similar, because all of the buildings have the same aspects and the same amenities available within them. So what you see in the Galactamics Rec Center for this particular set of guidelines, you would potentially see with the Galactamic Memorial and the Galactamic Community Center and the Gingoch Memorial Center. So it'll be very similar. We've worked with each of the village governments, along with Shelley Wilson, our Health Safety Environment Officer, to coordinate all of this, all of these topics, and ensure that we captured everything that the village government and the members of our Emergency Preparedness Committee felt needed to be included in this plan. So as we scroll down some more, there's different guidelines for the Giladamics Head Start and Nursery. So the screening of staff and children, for example, the screening if they feel unwell or showing any symptoms, if they just have a cold or the flu, with coughing or trying to limit the coughing or sneezing, that they not come into the child care facility. Encouraging the staff to work remotely from home and self-isolate for 14 days. And encouraging both parents and staff to contact Nishka Valley Health, again, for any required testing for COVID-19. You'll see similar information for physical distancing, cleaning, disinfecting. The Meals on Wheels program, as an example, has its own set of guidelines for a lunch area for staff and children returning to the center, as well as cleaning and disinfecting. That's a huge part of this program, and that is what would be required to ensure that we can continue to try to develop our plan to get to phase 3. So we also have Public Works building. They have their own plan as well regarding their staff area, cleaning stations, as well as designated entrances and exits. Place narrows, for example, down narrow one-way parts of their building, and ensuring that their safety measures are in place for all their staff, as well as visitors or companies doing business with any of these village government staff. So as we scroll down some more, you'll see the new Ianch gas bar and post office. Food preparation is also included in this, where the cooks must wear face masks and gloves while preparing food. Physical distancing is still encouraged there. The bathrooms, they have one specifically for staff and one for the public, and it's disinfected frequently during the work hours, so that continue to keep the level of hygiene at a high level. As we come down to the interpretive center, the screening of the staff as well as the individuals at high risk are encouraged to consult with their healthcare provider to determine if they should participate with public events. And we're just constantly stressing the hygiene. So the washing of your hands before you arrive there and before you go home. Encouraging participants to wash their hands frequently, as we've been saying for the last 15 weeks. That's one of the best countermeasures to spreading the virus. We have similar guidelines for Shanika's restaurant and the GNU store. So food orders are made out of their side window. Public are not allowed to enter the restaurant. And the screening of staff is still continues for there as well. And pretty much the same guidelines for the GNU stores with the screening of staff and the public as well. Disinfecting and cleaning on a regular basis using hand sanitizer for staff that's available for staff and public. So that's an overview of how each of the sections are laid out. So all of the buildings that typically have public access are included as per directions from each of the villages. As we come down to Gitwin-Silk, we have measures from the CEO and the bylaw officer. We have correspondence that they can follow specifically for to limit contact. So they use signatures using Adobe Sign, for example. Front receptionist has plexiglass for the front desk, as well as keeping designated record of all staff who's in and who's out of the building. And as an appendix to this plan near the end, you don't need to go there right now, but the main part of the plan, or the village's plan itself, that they've passed through their council, is included as an appendices, so that you can see the difference with the level of detail for the village, as well as what is included with this general overview for Gitwin-Silk Village Government, as well as the Eldup Memorial. So they have a very good plan for the rec center that has been developed and utilized throughout all 4 communities. Time slots is one of the ways that we're starting off as a way to use the rec center's facilities and amenities, such as working out and using the use of the court. The communication for this, as well as is the same as Giladamic. So on the online, the VHF signs and posters, and most of these information for these specific locations will be posted either on the village's website or social media, or on the building itself, as per the Ministry of BC's or WorkSafe BC's guidelines. Just so that everybody has a good grasp of all the procedures and guidelines that are in place for each of these buildings. One of the major topics that has been discussed many times during our meetings is cultural gatherings. So meetings or events that must be scheduled with the village government. It's available to WILPs for cultural gatherings on a restricted basis of not permitting more than 50 members at a time. Also keeping in mind that the size of the building in question would be also a determining factor in how many people can enter. So being able to maintain that social distancing within the building will also help determine the number of participants. So a gym can potentially hold 50 people, but say our church because of the size of the church, it's been determined that there's about the size of 14 people, or definitely less than 20. So that's just as an example of how the restriction for permitting 50 people, even though we say to a maximum of 50 people, we want to stress that it's up to the village government to determine, based on the size and space available, that number may be smaller. So just keep that in mind. For the weight rooms, similar to Galactamics, people must sign in for the weight rooms. Participants are asked not to touch other personal belongings. Equipment will be spaced out far enough apart so that you maintain social distancing. Pardon me. Encouraging participants to wash their hands frequently. Weight room will be tagged, so when users remove the tags, it indicates that that piece of equipment has been used and there's cleaning required. For the use of the court itself, it's only half court for this particular building, and the users must provide their own basketball, as an example. The youth center will remain closed until further plans are developed, so that's just a quick update on that. So as we get more in depth with the remaining plans, I wonder, Bobby, if you wanted to continue going through each village individually, or begin potentially ask or go on to the next part of the agenda.
Yeah, sure. I think you've provided a pretty good overview thus far, and just in reviewing them, a lot of the protocols are quite identical for each of the buildings. I think it's excellent that you and Shelley and the village representatives identified all of the buildings and carefully developed those protocols for them. And the full strat plan is available on our website, so you're free to check it out there on your own as well. So thank you for that, Anthony. We'll now move on to just pull up my agenda, to our updates and presentation from our Nishka Valley Health representatives. So I'd like to welcome Lisa Gosnell and Jeremy, who is a nurse in Galt, right? So welcome, and feel free to start off, Lisa.
Hi, thank you, Bobby. So I'm just going to give an overview on what we've been doing, and then Jeremy could elaborate on what I'm going to present. So we have been working on our resource, like our soft opening, and we worked with our internal EOC. We meet every Wednesday, so this is something that we have been, we have our own COVID planning framework that is internal. So we were looking at it, and Dr. Penner has been a very excellent person to be on with us, and he's been working with each of our departments to see what our openings would look like. For instance, with our home care, what's that going to look like once they get out into the communities? How can we protect our workers as well as the clients that they're going to see? So he provided each one of our team leads with a process for each one of them to go through. So these are things that we can share on our website and our Facebook. We did have a contest that we put on our Facebook at the beginning, how to keep safe and washing your hands. So check that out, because it has some really good people coming forward to show us what they thought. We also thought about how can we deliver the message when somebody's coming to the health center. How does that look? So we started doing mini clips on Friday, what it looks like when you come to the door in IANCH, the upper level, when you're seeing the nurse. So we did the one for each health center, and we did the walkthrough. So that's going to be put on our Facebook. We also decided we can add our departments in there. So we also added the non-insured What's that going to look like? The new norm. When you come and ride our bus, what's that going to look like? Because we have processes for each one, and washing your hands and using face masks, even the homemade face masks. I have one here. Like in some areas of our buildings, it's small enough so that we have to use our face masks when passing, and we have the tape down. So I was talking about Dr. Penner. Jeremy and Lydia are 3 key players in our EOC, so they give us lots of feedback on everything that's going. And our doctors, as of June 22nd, went back into the communities. So if the people don't have that update, just letting you know that you can make your doctor's appointments by calling each of the health centers. And our medical bus also started on June 22nd. So we do have a protocol, and asking people to wear homemade masks when they come on, and to call the health center to get their names added on there. And all our updates go on to our Facebook. We have a crew that actually makes sure that we're updating as much as we can. We do have our plexiglass up at each of our front receptionists, but we had to look at that a little further. What does that look like? How can we protect our front receptionists? Because we do have that plexiglass, and we also looked further into that and decided, okay, they can wear face masks if they have to. And we have our employee practices that Dr. Penner gave out. So there's protocols for each one of us when we enter the building. Before we come to work, we have to ask ourselves, how are we feeling? And then when we get here, so there's a process that we have that Dr. Penner had worked with us. So we have to answer all these questions before we come in, and throughout the day, and when we leave. So we have check-in points as well. When you first come in, we have our temperature checks, and we also have who's going to be in the building. And we had to look at the wide range. How can we protect the clients when they're coming in? How many can come in? Are we keeping our doors locked? So these are all the questions that we've had. We also have the process for our PPEs, for each program that's going to be starting. If it's direct contact, what are they going to need to use? How can we protect them? Some of them can be wearing homemade face masks, while others have to put on the whole gown and everything. It depends on what they're going in for, because some will be going into homes. So we have came up with all the processes and everything that we need to do. We still feel that we need to have our COVID rooms in each health center, so we did not dismantle that. Jeremy can elaborate on that one. We also have vehicles in each communities that we have in place, and we're going to keep in place for COVID. That way we have transport vehicles ready in each health center. So if Jeremy wants to take it over from here.
Thanks, Lisa. Yes, I can elaborate on the isolation rooms. Each clinic we've kept the COVID rooms isolation room. So the process is we're continuing on with the phone screening before the in-person health center visit. So ideally, no walk-ins unless it's an emergency. Everyone is supposed to call first, and reception will book a telephone appointment with either a nurse or a physician. And then after speaking with us, so we can do our pre-screening, then we'll get people to come into the clinic if it's something that we feel needs to be seen physically. And that's just to help prevent a lot of traffic from coming through in a crowd control kind of sense. We've limited the waiting rooms to 3 people max. Lisa, correct me if I'm wrong for the other health centers, but it's 3 people max with the chairs spaced out 6 feet apart. And any more than that, unfortunately, if it comes to it, have to wait outside at the moment. So we have the isolation rooms we're going to be keeping. I think the only one that actually changed was in New Iance. We had to move the room in order to open up the emergency doors, because we've just like Anthony was explaining in all the other buildings, we also have arrows on the floor now to show like we enter through the front door, and there's a direct access to exit through the back door after your appointment, so that people aren't crossing paths. What else am I missing, Lisa? I feel like we talk about so much.
Yes, I think you pretty well covered it. But also we were discussing regarding the screening, that's still going to continue.
Yes, yeah. The screening is still taking place. The nurse or physician will do the pre-screening. There's a specific set of questions related to COVID-19 as per the BC CDC guidelines that we will be asking before you come into the clinic, just so we know, so that if you've answered yes to basically any flu or cold-like symptoms, then we know that we can take you into the isolation room just as a precaution. It doesn't mean that we're worried about COVID-19 specifically, but it's a precaution that we take in order to protect us, anyone else that might be at the clinic, and the clinic itself, because we have to make sure that the environment stays clean so that we can protect anyone coming into the environment.
Okay, excellent.
So Bobby, I just want to do an update with everybody's and a reminder, we have done 107 tests so far. We have 0 positive, 104 negative, and 3 are pending.
Okay, perfect. Thanks for that, Lisa. I was just gonna ask you to provide those statistics. So that's excellent to hear. So what are the protocols for someone that may want to get tested?
It is pretty simple. It's the same thing as booking an appointment with a physician or nurse. You just call into the clinic. We recommend anyone with any symptom at all, just as Anthony had laid out, any flu-like symptoms, runny nose, fever, cough, sore throat. Anyone with any symptoms should get a COVID test. In a lot of ways, the risk may be low, but we don't want to take that chance. We'd rather be overly cautious than not cautious enough. So anyone with any symptoms, just call into the clinic and ask if they can be booked in for a COVID swab. We do them right now we're doing them Tuesday, Thursday mornings, or Monday, Wednesday afternoon, the same as our lab times. They're just booked in with our labs, and we coordinate in the clinic with the nurses for who's doing the swabbing and who's doing the lab, the other side lab work. Everything requires an appointment. That's the biggest thing. Whereas before labs, people could just come in as is, just walk in. We are requiring that people book in for lab work as well, or COVID swabbing.
Okay, great, thank you. Very important information to know that you're required to phone ahead whenever you want to make an appointment at any of the health centers in the Valley. So thank you to all of our panelists for your excellent presentations. It's very valuable information. And we do have 56 participants on with us right now. And we did mention that there would be an opportunity for a question and answer at the end of the presentations. So if any of our 56 participants have any questions for our panelists in relation to their presentations, their respective presentations, you have an opportunity to pose a question through the Q&A box at the bottom of your screen, and we will entertain your questions. And just while you have some time to do that, we did receive some questions by email when we provided notice of this webinar. So Anthony, in your presentation, you touched on the recreation facilities, and no doubt there are many young folks in the Valley that want to get back to being active and accessing those facilities. So can you give an example of maybe what some of the villages have developed in terms of protocols for such things as the gymnasium and workout rooms?
Sure. So as an example, from what we had with the village of Gitwin-Sisk, we had, just pulling it up here, specific examples on how to access and book a spot within the rec center itself. So you do that by contacting the village government and booking one of the times with the main reception there. And it's currently open between 9 and 4, and I believe it's 3 time slots that were available. Members must book an appointment with the front receptionist. There is no drop-ins for this, so all names for the booking must be provided upon booking. The front receptionist will maintain the booking schedule for each day and will be provided to the applicable village government workers. Only one household or family at a time, or on review and approval. Members that can combine their household with 1 or 2 others. Many families within the same immediate family, parents or siblings, have remained within their own social bubble. It'll be a one hour max per user, and the time can be extended within reason if there is no booking followed. There's also flex in the schedule and the cleaning requirement. So we also have Linda here. She's the one who helped to really develop the protocols for the specific use of the recreation center, and she'd be able to get into more detail what specifically would be used and the definition of a social bubble, for example, if Linda would be willing to.
Good afternoon. Can you hear me?
Yes.
Yes.
Okay, perfect. With respect to Anthony's comment on immediate family members, so for example, if I wanted to access a rec center and I stayed in close contact with one of my siblings and their family and with my parents, we can all book on approval to access the recreation center at the same time. We've been in close contact with each other since COVID started, and it's similar to some members in the village that they've maintained their social bubble right since the pandemic started. So on approval, we'd have to review the request first, and on our review, we can approve those family members joining within an appointment. I just wanted to comment further on the rec center can only be utilized by members from the village. At this point, we're not opening it up to any other villages. I know that with some sports like basketball that we have opened it up in the past. Right now, we can't do that. We need to ensure the social distancing. We did have a walkthrough last Friday. Trial run last Friday with a family in the village, and it worked wonderful. So immediately upon entering, and we only have them accessing the back entrance. We're very mindful of safety, so we review a whole list of the rules with them, and as we're reviewing it, we're doing a walkthrough because the walkthrough really makes sense of what the rules are. And after we're completed the review, we ask the users, do you accept the terms? And it's very clear. We've already got quite a few comments back that our requirements are very clear. Sorry, my blinds are open so you can hear it flapping in the background. Anyway, it's very clear and we're quite excited. The rec center is open as of yesterday and going very well. we're already looking at extending the hours to the evening to accommodate individuals who have returned back to work. Thank you. We do have just one final comment. We only have limited bookings in between because we have the cleaning requirements in between each session. As Anthony indicated, for example, the exercise equipment, every piece of equipment is tagged. And when a user uses an equipment, a piece of equipment to take the tag off, that gives us an indication of what equipment's been used so that we could clean. In addition, so for example, if they use weights, they have to move the weights in front. So if we have everything clearly outlined in terms of access to the exercise equipment. There's no children allowed in the exercise area, otherwise we'd have to clean the entire area. As you know, children are children and they'll run freely. So we have limited restricted access to the exercise area from children for that purpose. And the users so far are quite understanding of it. We're working with our youth worker and our recreation center worker to support our opening so that they can provide limited activities for children especially, because they'll be in the gym at the same time as their parents. We do have medical grade cleaner that we're using in the rec center. We have this piece of equipment that can mist everything, like it's similar to other cleaning devices that you've seen, and we can spray the whole entire area, and then the janitor will go back and he'll wipe every piece of equipment off. We do have areas partitioned off, as you noted, with half the gym. We did space it for the cultural gathering, so we're already prepared for that. And the chairs, if we had to do an event like a memorial service, we're only putting 50 chairs in, so we already have the logistics all worked out in terms of how we would address that. We would open up more areas of the rec center for a cultural gathering. Right now, the whole lobby area, the main entrance and the kitchen are not accessible right now by rec center users. So you'll see if you come into I sent Anthony some pictures. We have quite a number of the areas partitioned off with the 4 feet high orange warning barrier, and it's very effective. So anyway, that's a quick overview. I can go on, but we're quite happy with it. Thank you.
Great, thank you, Linda. We did have a number of other questions come in, so well, in the interest of time, we'll move on to those. And this is a health-related one, so Lisa and Jeremy. Thank you for the presentation and information. Will blood tests also be available to be taken to confirm if citizens have had COVID-19 in the past, to confirm if anyone was asymptomatic?
It's funny that you asked me that, because I was actually just going to respond, type the response. They're not currently available. We have had a few discussions regarding the blood tests, and I don't want to give out the wrong information, but with our medical director, he had said that it's not widely available enough, and it could be due to accuracy, but I'm not completely positive. But right now they're not available in the Valley for blood tests. The best, most efficient test is the swab to find out if you currently have COVID-19. And that's why we will test asymptomatic as well. If you feel like you've exposed yourself by traveling somewhere, we will test asymptomatically.
Okay, great, thank you. And this other question is sort of in relation to that as well. And as we know, this strategic plan is for the nation and Nass Valley residents only. So technically we're still we're open locally. And this question is in relation to, so what happens if park visitors that live outside of the Valley need to come to the health center? What are the protocols for health services, or will they be asked to go to Terrace?
Sorry about that. This was in regards to if someone outside the valley needs a health center, Bobby?
Yes, health services.
Okay, so we can't stop. Like we're still going to get people walking in. There are people without phones or don't have access to a phone, or in this case, you know, workers or people that have entered the valley that need urgent or emergent health services. So what we have in place is if there happens to be someone who walks, like just a walk-in, they're not allowed to enter the building until they can be pre-screened by like myself as a nurse or physician. So the pre-screening will be done outside to find out if there's any risk. And then because they're not actually from the valley, from their outside, if we would use our discretion in terms of giving them a mask to wear if we had to see them in the clinic. In a lot of ways, it could be dealt with. A lot of things can be dealt with outside of the center in order to keep our health center safe and the people safe within it. So to answer the question, yes, they would be seen. They would just be screening done before they're allowed to enter the health facility, and it would be on an urgent or emergent basis.
Okay, great. Thank you for that. So Anthony, perhaps this is for you. One of our participants has a question about our feasting system and how this will look going forward in terms of traditional customs and protocols we would normally perform, such as sharing of foods and distribution of dry goods and whatnot. Nope, you're on mute.
Yeah, seen that right away. So with the feasting system, I know that the protocols have changed a lot over the last 15 weeks in us really not being able to hold any feasts. So the procedures are still in place for the number of people who can gather in a public setting. And the only time we'll be able to begin holding a regular feast would be in phase 4. Basically around the time we would be able to have a vaccine for this current pandemic. With regards to phase 3, that's only lifts a little bit more restrictions on things like kids allowed to go to school, overnight use at recreational sites, and things like that. But with regards to the feasting system, unfortunately, until we get to phase 4, and we also received direction from the Council of Elders that this will likely not be changing, and a lot of the feasts that are currently planned have already followed suit and postponed and began to plan for the future, and not really host any feasts this fall. So unfortunately, the feasting system doesn't allow us to be able to fully go through say a settlement feast or a stone moving feast, for example, with the number of attendees that typically attend. So large gatherings like that, just once again, wouldn't be happening until we get to phase 4.
Okay, excellent, thank you. Another question in relation to recreation sites. So as we know, the Nishka Nation has 3 designated recreation sites through the Director of Lands and Resources, and those are Dragon Lake, Shkoiskud Hot Springs, and Skint, which is a popular fishing site. What is the status of these locations?
So with the sites that are governed by the Lands and Resources Department, the hot springs, just because of the nature of what it is, and we don't recommend opening that at this point. It was actually closed by executive resolution as well. and it'll be up to the Director of Lands and Resources to determine whether that is a safety plan that would be sufficient to be able to reopen that. With regards to things like Dragon Lake, that site currently requires a bit of work to be able to reopen, so that will likely be waiting until we get to phase 3 or until the site is deemed safe. There's a lot of danger trees and things like that actually that need to be removed. So, and there's, because of the restrictions with our lakes, there's just no timeline established for that. For areas like the Skink, that is also area that has remained closed for the simple purposes that we wouldn't be able to maintain a certain number of people there for whether they're trying to camp there overnight or during the day for day use. So for the moment, those 3 sites are closed. And with other sites within the Nass Valley regarding the Provincial Park, I'll just segue into that if that's all right, Bobby.
Sure, but just before that, I just another spin-off question in relation to those sites. I understand they're patrolled by NLG's Department of Compliance and Enforcement. So how would a citizen or anyone report non-compliance?
So the easiest way is through the reporting tool that our enforcement department has been sharing on a regular basis. So it's a simple online tool where it'll ask you a series of questions, and you type in the information that you want, and you can decide to whether you want to remain anonymous in your submission, or if you could type in your name and contact info, they would get back to you with a follow-up to ensure that you understand that what you submitted to them has been dealt with. So that was one of the easiest ways. The numbers, because of the nature of their business, they're not always by the phone, but they receive their updates instantaneously to their trucks through their devices for these reports. So they also have a Facebook page, Nishka's Government Compliance and Enforcement, that you can also connect with them, and they have that's another way to access the reporting tool is through the contact button on that site.
Okay, great, thank you. So you were going to segue into another.
Yes, so the provincial parks. I know there was a question about park visitors and people who live outside the valley. So as we've been working with our partners with BC Parks, we've also established as Appendix A in this plan, the Nishka Park reopening plan. And they follow a different set of phases. So their phase 1 is actually not the response to, and closure of the park, but their first part into reopening. So the campground sites will be open at Vetter because the spaces already provide enough space that groups can maintain physical distancing. Most auto tour sites will be reopened, as well as pit toilets and picnic table sites. The ones that will remain closed are the CX Bridge parking area, the parking lot between the boat launch and the CX that you typically see on the right side, but on the lava beds, as well as the boat launch itself. The other location is the walking path to the fish wheel at the Gitwood Silk Bridge at the entrance there. And the reasons those will remain closed is because they're in close proximity to the communities. And we want to ensure that highway users who just want to come and view the Nass know that there's still restrictions for tourists within the villages themselves, and certain parts of the park just because of the proximity to the communities. So areas like the dedication site where the hand points to Gitwin Silk, all of the tour sites at Vetter Falls and along those areas will be open, and phase 2 will be coming down the road, where things like Lava Lake will be opening, as well as the visitor center at Vetter Creek campground there. So the campsite will be open, but the visitor center itself will remain closed. So that's just a quick update on BC Parks as well. So how that falls into place with our current plan. And that can be found in Appendix A of our strategic restart plan.
Perfect, thanks. So we have a few minutes left, so if you have any other questions you'd like to ask any of our panelists, and one just popped in. If tourists will be in, if tourists will be in the open park areas soon, what will happen if they come into the villages that have gasoline services to fuel their vehicles?
So I could take that on as well. With the parks as well, in coordination with BC Parks and the Ministry of Transportation, in coordinated efforts with them, we've asked that the messages that they convey that people utilize for travel, that people still could stay out of the communities themselves. Services within the communities are off limits to tourists still, and those can all be found at the similar sites that the general public use for BC Parks and the Ministry of Transportation. So we're all conveying the same messages. You'll soon see that as well on the messaging board on the LED signs coming into the Nashram Terrace, that the parks are open but limited services, and still maintain that the villages are closed. We also established signage that you see on the highway on the Cranberry. So the tourist sites are still closed, the boat launches are still closed. None of that has really changed, and that is what we'll be maintaining until we can get to phase 3, and then we'll determine what phase 3 is when we get to that point.
Okay, great. Thank you, Anthony. So once again, a couple more minutes for questions. How are elders being provided services at home, and how are they receiving services at health centers? Do they have designated areas to wait? Lisa or Jeremy, that would be for you.
Are you taking this one, Lisa?
I could take the second part. You could start the.
So the services at home, so the home care services are restarting. We have an LPN, we have the home support workers that are restarting their visits, and we have protocols in place for those visits in terms of proper protective gear that they should wear in the home, any pre-screening that might need to take place prior to the visit. Even if it's a regular weekly visit, they're going to pre-screen each and every visit in case something changes. And that's for any home care, anyone on home care. Anyone not on home care will still be screened prior to coming to the health center. We do our best to provide, and Lisa can correct me if I'm wrong, we still do our best to provide any transportation if we can to get over to the health center if they're limited mobility, or if there's no family member that can bring them over. So, but anyone not on home care is still at the health center. There's still pre-screening that involved that we discuss with them prior to their appointment. Lisa, if you have anything to add?
with our home care. And this past week, they have been calling each of their clients to see whether or not they want them back in their home or what services they'd like. So that's what we're doing this week. That way we could launch the program starting next week. They are doing their screening, like Jeremy said. There's a protocol that they have to follow with each client that they see, but they have been contacting each of their clients in each community.
Sorry, just before Bobby, I'll just add to that, because I just noticed the last piece of that question was, do they have designated areas to wait? There's no specific designated area to wait in clinic. It's just the 3 max in the waiting room, 6 feet apart from one another. We are asking people that do come to clinic, if they have a mask, to wear it. And it can be a homemade mask, because it's not patient specific care. You'll see us with our medical masks, but for the general public, we do ask if they can to wear a homemade mask when they come for their appointment.
Okay, great. Thank you both. So there's no further questions incoming. So at this stage, I would like to provide the panelists an opportunity for a moment or two of closing comments. Ryan, starting with you.
Thanks, Bobby, and thanks to all the panelists for that great webinar. That was really interesting to listen to all the plans for reopening and all the thought and consideration that went into everything there. Not a lot extra for me, I don't think. I'm just encourage anybody who has any questions about the different programs to check out the website and reach out to the team at well, all the panelists and anybody that you've seen in other webinars if you have questions. And if there's anything that I can ever do to help, please feel free to get a hold of me. Thanks again.
Excellent. Thanks for joining us today, Ryan, and we look forward to your participation in future webinars. Speaking of which, we are in the planning stages of our next in the series of webinars with a focus on support for businesses. So if you know of any small businesses that may have questions or seeking feedback about federal provincial programs in relation to COVID funding, please tell them to check our website for updates on when that will take place. We will have Britt Mercer participating on that as well. And we will also have a webinar focused on supports for students of all ages. And Denise Verreau and Bev Azak will be joining us along with the Education Service Providers Working Group. So we'll look forward to that. And if you have any questions in relation to federal or provincial programs in relation to COVID that you would want addressed, please feel free to forward them to my department at communications@nishka.net. So with that, Anthony, closing comments. Oh, and just to put one of our guests, Damien Azak, on notice, I'm going to be calling on you for a word of prayer as part of our closing. If you have audio capabilities, hopefully. But when we get to that stage, I will call on you. Anthony?
Sure. Thank you, Bobby. Yeah, we've been working very steadily on this plan and our overall response to this entire pandemic. And I just want to acknowledge the hard work and efforts of everybody within the Emergency Preparedness Committee, which is emergency coordinators from each of the 4 villages, as well as the CEO or CAO of each village. My staff, Michael Moore and Shelley Wilson. Shelley's done a lot of work on this plan specifically in coordinating with all the villages, as well as the churches, the school district, the health authorities. And we're very happy to be able to get to this point and begin planning phase 2. I know a lot of people have been frustrated with the timelines, things we try not to move as fast as the province does. My whole mentality when it comes to new things and changes is I want to see how effective they are with it before I try to do it. And I'm using that same approach with this phased approach with the Works APC and Ministry of Health, and seeing how well their phase 2 went before we tried to implement it. And a lot of the timeline falls in place with our reporting to executive as well. So that's why we chose specifically June 29th as our phase 2 start, and keep the lines open for when we can try get to phase 3 using those same triggers as we have done right from the beginning. How the BC North is doing with Northern Health, as well as what's specifically going on in the Terrace, Prince Rupert, Kitimat area, as those areas fall really close to the Nass Valley here, and how the world is responding with regards to other provinces and the states, as they're so close to us, considering the amount of travel people do. So I just want to thank you all for joining the webinar. I appreciate all the questions. I hope I answered them all effectively for you. And we look forward to continuing our EOC at level 1 and monitoring the entire situation and trying to keep our people safe here. That's our #1 goal. Thank you, Bobby.
Great, thank you for that, Anthony. And Lisa and Jeremy.
Hi. I'd just like to thank everybody for watching this, and also for the invitation so that we can share what we're doing within our health centers, because we have 4 that we have to open up into this phase 2, and making sure that the prep is all ready. And I want everybody to know that they should feel safe when they come here. We do have our hand washing stations at every entrance, and then this is something that we're also going to be providing our staff with, the hand sanitizers and spray bottles, so that we're keeping everything clean. So thank you.
Yes, I'd like to reiterate what Lisa said. Thank you very much for the invite, for watching, for listening. And to put it out there, yeah, we do. The most important thing is keeping the community safe. We are set up the best that we can. We have the hand washing stations. We have the hand sanitizer. We as staff wear our personal protective gear when during patient care, during patient visits. Our largest priority is keeping the community safe. So with that in mind, thank you.
Okay, excellent. Thank you all. Very excellent presentation and questions posed by our participants. So thank you all for your participation. Damien, I'm just going to test your audio. So I've just added you now. Did you want to try it out? Unmute.
Hello, can you hear me?
Yes, perfect. So
Excellent.
I also wanted to invite you, because of the excellent work that the Gidwin Salvation Army is doing with the food share program. If you wanted to just provide a brief update on what you've been doing with that before you close in prayer.
Yep. So since the pandemic, we've been delivering to all 4 communities. We first started with Tuesdays and Thursdays, because those are our food share days. And then as the provincial guidelines changed, so did our food share. So we only delivered on Thursdays, and we still have a pickup window on Tuesdays. So while our deliveries were actually happening both Tuesdays and Thursdays, we still had a pickup window open the regular food share days. So we've been busy since the pandemic, maybe 5 times busy than we were before. And we're delivering so our last day of deliveries will be July 9th. After that, we'll continue with our pickup window on Tuesdays from 1 to 3, and we have set up a plan so that one person can enter the building and choose their food the way they have in the past before the pandemic. And but there's plans in place for people to wear masks, wear gloves while they're in the food share room. And we'll set up the parking lot so that people can social distance. So it's a lot of work, but that's basically what we were working towards from the beginning. Just getting there was a lot of work, but yeah, we're looking forward to it. Excited for the new plan as of after July 9th. Yeah, and it's been great. There's been a lot of people supporting through fundraising or through donations, and our awesome deliverers delivering to all 4 communities. It's been great. So yeah, that's it in a nutshell.
Okay, great, thank you. So of course, you probably welcome more volunteers if any are willing, right, for delivery?
Yes, up until July 9th. July 9th is our last delivery, so next week.
Oh, okay, awesome.
Yeah.
Great, thank you very much.
Yeah.
So, just closing prayer now.
Yeah. Heavenly Father, we thank you for this day that you've given us. We thank you for each person here that has presented and answered questions. We thank you for we thank you that they continue to do all the hard work that needs to be done to serve the people. I know it's hard, it's difficult. There's a lot of work involved because of the times that we're in. So I just thank you for their lives and their dedication to this. And I just pray that you continue to give them strength and guide them, give them the wisdom needed to continue to serve. Thank you, Lord, for all that you've done, all that you're doing, and all that you will do. All this we pray in your precious name. Amen.
Amen. Thank you very much, everyone. Have a good afternoon.